Hi everyone, you're welcome back to my channel. To all my returning subscribers, I say welcome back. And if today is your first time of seeing this face, my name is Flora. I like to do health tips, health talks, give tips on life-saving strategies and lifestyle in general. So this is basically what we do on this channel. We try to break down the difficult, challenging health situations or disease conditions into tiny meal bits so that we can all understand it as a layman. Okay, so this is what we do basically here on this channel. So today we're gonna be talking about stroke. Or before now, I want to say that we have done some other series on diabetes. We've done something on diabetic foot care also, so you can do well to check it on this channel as well. Okay, so but today we're gonna be doing something very interesting. It's called stroke. Yeah, stroke, because we see that in the society today, globally, we can see that stroke is really a leading cause of death and disability. So, but according, like me, I like to do statistics. So, according to the World Stroke Organization, they've given us statistics stating that 1 in 4 adults over the age of 25 will experience a stroke in their lifetime. Yes, scary, isn't it? And also 60% of stroke occurs in persons under the age of 70, while 16% occurs under the age of 50. 30% of recurrence of the stroke in persons with previous experience or episode of stroke. Yeah, so complications of stroke, things like brain damage, long-term disability, and speech communication difficulty has been known to be attached to this condition. Okay, so what exactly is stroke, right? So I will describe stroke as when the blood stops flowing to a part of your brain due to blood clots, which is an occlusion, or bleeding, also termed as a hemorrhage. Yeah, it can affect the speech, movement, causing long-term disability, like I said earlier, and brain damage. Yeah, the recovery time for stroke is extended. It is a long-term situation. Yeah, I don't want to call it a disease. It is a long-term management period. Okay, and it can be managed. Yes, you can still live your life with stroke. Yes. Okay, so it is a medical emergency, so it's also termed as a life-threatening situation. So if you know someone or anyone around you having a stroke, whatever time of the day, maybe in the club or maybe in the market, in the shop, you're going for grocery and someone falls beside you, or at the bus stop, whatever, you know, dial 999 for an ambulance immediately. And if you are in the UK, or 911 in the USA for an emergency um, treatment or help. Okay, so because this is every minute in stroke counts, so this is very, very important, right? I just wanted to put it out there first. Okay, so we have two types of stroke. We have the ischemic stroke, and we also have the hemorrhagic stroke. So the ischemic stroke is caused by blood clots in the arteries, which is responsible for about 65.3% of incidence of stroke. And we have the hemorrhagic stroke, which is caused by bleeding into the brain due to a ruptured artery, resulting in intracranial pressure. This is further divided into two types. We've got the intracerebral hemorrhage, which is at 28.8% of incidence of stroke, while the subarachnoid hemorrhage is at 5.8% of stroke, right? So both of these stroke prevent oxygenation and nutrients supply to the brain cells to be diminished, leading to death within minutes. Yeah. So the brain cells can die once it is starved of oxygen or nutrients. It dies. Yeah. So the signs and symptoms that we can easily notice, we have things like mild numbness, numbness on the right or left side of the face or body. Yeah, severe headaches. We have slurred speech, dysarthria. We have difficulty in speaking, dysphonia, sudden weakness, blurred vision. All of these things. Once you note this or on your partner, please dial 999 in the UK or 911 if you are in the USA. You need to send for an ambulance immediately. All right. Okay, so we also have predisposing factors to this condition. We have things like smoking. So long-term smokers are liable. Yeah. Persons with high BMI, obesity, lack of physical exercise or activities. You just sit on your couch all day, you eat all day, you just get fat, and this kind of things. You need to do an exercise because the WHO have stated that at least we have to exercise 3 times in a week. It is, please, whatever, even a long walk is fine. You can just do a walk a day and that's fine. It counts for something. Okay. We also have diabetes as one of another predisposing factor. Diabetes, hypertension, high fasting plasma glucose. Yeah, all of these can also predispose one to the situation. Okay, so what are the treatment options that we have for stroke? So from the time you call for the ambulance and you arrive at the emergency department of the hospital, in the ER, the stroke specialist teams have been notified. They come to see you, they assess your condition, they take history from you, they check your observations, your vital signs. With this, I mean your blood pressure, your pulse, your heart rates, and your temperature is all checked. And then they do an ECG on you, which is like a tracing of your heart, and also they do a CT scan, an MRI head. This also helps to determine the extent of bleeding or the location of these clots. Okay, then also take bloods from you. If stroke is confirmed at this point, yeah, a direct admission to the acute stroke unit within 4 hours is key. Yes. Okay, so for ischemic stroke, what treatments do we have? The treatment options we have for ischemic stroke, we have like two. We do thrombolysis or thrombectomy. So with thrombolysis, this is when we use medication, also known as clot bursting drugs, like alteplase or tenecteplase, given intravenously to dissolve clots in the blood vessels. Okay, when this is done, the blood flows back into circulation and that it makes the patient feels better. Then we also have another one which we do, which is a thrombectomy. So for thrombectomy is the surgical removal of these blood clots by inserting a catheter through the groin of the individual. This is done surgically under surgical techniques. Okay, and this helps the patients. Once the clot is taken out, the blood circulation returns to normal. And the good thing about this is it prevents disability and aids faster recovery for patients with stroke. Right, so that's what we have. And also another thing which we can do for hemorrhagic stroke persons is that because we said it is a hemorrhage, right, there is bleeding, so we have to focus on controlling the bleeding first. Then second of all, we have to try and reduce the pressure in the brain, take out what is causing the pressure and on in the brain. Yeah, then we also do manage complications from this: surgery to remove blood clots, medications like pain relief, anticonvulsants, antihypertensive to manage the blood pressure. We have to keep it at a particular range. Okay, so all of this is what we do as our options. Then what do we do to manage this situation after the stroke? Yeah, so paramount to improving the lifestyle, um, living onwards from here, is to do rehabilitation of these persons, and lifestyle changes have to be effected. So we have things like the speech therapy, we do physical therapy, and we also do occupational therapy for these persons. So with all of this, we introduce the speech and language therapies to help with the swallowing techniques and also communication. With a variety of technology now, this a lot of things or instruments or equipment are available to aid this area. Okay, then for physical therapy, we have to help the patient regain strength, balance, and mobility by introducing lots of equipment like the walkers and all of them. And this, with a lot of exercise, it helps the patient to go back living their life as normal. Then we also do occupational therapy, where we improve their daily living skills, like how to prepare breakfast, how to make your tea, coffee, all of that. Just little things you can do around your home by yourself or with the aid of your partner. So all of this will be done, and you will be taught how to do this by yourself. Okay, so all of this is what we do for patients with stroke, helping them to manage their life going forward. Okay, so if you have enjoyed this so far till now, as we have come to the end, I want to say thank you very much for staying around with us to watch to the end of this video. And please kindly subscribe to this channel, like, comment, and share. You can leave your comments, whatever. Till I come your way again next time, thank you for watching, and I'll see you on the next one. Bye.